All right, good evening and welcome. My name is Carla Sierra and I'm the director for the LIBRE initiative here in the great city of El Paso, Texas. LIBRE is a nonprofit, nonpartisan organization that strives to empower the Hispanic community, but more importantly, to work and partner with anyone to do good and no one to do harm. Today, we're joined by Jorge Martinez, the Texas Coalition Director of the LIBRE initiative. Jorge is a graduate of California State University, Fresno, where he received his Bachelor of Arts degree in communication and later earned a Master of Public Administration from California Baptist University. Jorge has served in various roles with the LIBRE initiative since 2012 and is currently the Texas Coalition's director. In 2015, he was appointed by Governor Greg Abbott to the Texas Physician Assistant Board and serves on the Ethics and Disciplinary Committee. He serves as Chairman Emeritus of the Citizens Advisory Committee of the City of Mission, Texas, and also serves as an Accountability Board member for New Life Family Church in McAllen, Texas. Jorge, thank you so much for joining us today. We really appreciate your time.
Thanks for having me, Carla. It's great to be here with you.
And we're so excited because I know that session kicked off several weeks ago, and all of us have been working really diligently with some of our reps around the state, and we're just excited to hear your perspective on a lot of different issues. So we're excited to hear everything that you have to share with us. So before we get started, I know that some of our audience is not too familiar what exactly a coalition director might do for LIBRE. So we'd like you to share some of the great work that you've been doing around the state.
Well, thanks again, Carla. A little bit about a coalitions director and what I do in my role. There are a few areas that I focus on. The one of main priority, especially right now during session, is being our government affairs spokesperson, basically someone who is meeting with members of our state legislature, members of Congress that are out of Texas, and kind of sharing your stories, the grassroots activist, the volunteer, people in our community, explaining and sharing the stories that are impacting us. So that's one main area of my job, my role. The other is speaking to you, members of the community, and on the media, kind of sharing and spreading our message that we share as an organization. And then the other part is also just being a supportive member internally for our staff.
That's perfect. And we know that you've been with the organization for quite some time, so I'm sure that you're an expert in a lot of the things that we've been working around the state, especially when it comes to all the Hispanics. So currently there are approximately, and obviously this is an estimate, but there's 11.4 million Hispanics in Texas, many of whom are first, second, and third generation immigrants from Mexico or other Latin American countries. What does the American dream mean to you?
Well, when I think about the American dream, I first got to say everyone has a different version of whatever their American dream is. And for me, I have to look at where my parents came from and what they did. My parents actually had me. I was born in Mexico. At the time, it was during the holiday season, so they were visiting their parents, my grandparents. But they already lived in the U.S. My parents were migrant farm workers out of California. And they followed the crop season in different states, but they settled in the Central Valley of California. So that's where my roots are. And I didn't know this at the time, but we were low income. A low skilled job like farm labor. It's hard work and it doesn't pay a lot. And I didn't know this either, but at that time, but until I got older, my parents showed me that they didn't depend on government assistance. But they still provided for their family, and they wanted opportunity so that my brother, my sisters, and I can get ahead and have that chance and that opportunity to the American dream. So for me, what is the American dream? For me, was able to get my college degree. That was something big for my family because that was a hurdle in our family. That was the first one. I am the baby, the last of 4 children. But I was able to get my bachelor's and then later on my graduate degree. So that was part of it. The other part was, now that I'm a father, is not only just to buy a home, but was to own my home. And thankfully for me, one of my dreams was to own the home and to not owe anybody anything. Because I really want to take care of my family. I don't want to depend on others, and I want to be able to to make sure there's a roof over their heads, that I'm providing a meal, that there's food on the table. And I know that when we think about our basic needs, those are the things that I want. I want my basic needs taken care of, and knowing that my family is healthy and well and taking care of our that's my American dream. And I get to share that with this role that I have with Libre and the career that I love.
And that your story, your personal story, certainly resonates with a lot of folks in our audience. And what part of Mexico did your family migrate from?
Yeah, we're from Monterrey, Nuevo León, Mexico, from a small rancho outside of Monterrey. It's pertenece a los Ramones. It's called El Peine, or also Facundo Gonzalez. Very small town, near also from where our founder and president is from, near the same area.
That's right. Our founder and president, Daniel Garza, has a very similar story, and he shared it all over the country. And just like you, I'm very proud and passionate to be able to be a part of Libre. And so I just hope that we continue to spread these very great stories that a lot of us have when it comes to our families and how we got to the States. And kind of touching a bit on that same topic, obviously immigration reform continues to be an important topic for many Hispanics, especially here in Texas with so many Hispanics that are living here. And the Hispanic culture is very rich. I mean, obviously you come from a small pueblo, your family comes from a small pueblo in Mexico, but we have friends and family members who are either dreamers or have experienced a daunting immigration process. What are some solutions Libre would incorporate to improve the immigration system?
Well, when we look at immigration, and I'm looking at immigration as a whole here, there are a few areas that we need to look at. One is being able to be flexible and allow for that flow of immigrants that want to come to this country and contribute to our society, our economy, and allow that in a meaningful way where we're not limiting access, but at the same time, we're also looking, since we're a nation of laws, at our border security. So if you're looking at more infrastructure, if you're looking at border patrol agents, if you're looking at more technology or a combination of all that, as a nation of laws, we want to make sure that our borders are protected. Now, Carla, you live on a border. I live at the border and further down south. And when I talk to my neighbors, when I talk to members in my church, we all want a safe community. So I definitely don't want to have any violent stuff going on around my neighborhood, because I got kids. I want to protect them. So we have to look at that, and we need to know who's coming in and out of the country. But we also need to respond to market forces. Looking at my parents, they came in to do a low-skilled job, and they had the ability to come here and work and fulfill a need that the market was demanding. And so we need to allow for that. You can see at big corporations like Moderna or Pfizer, one of those organizations, and there's few like AT&T that were founded by immigrants or their parents were immigrants. These are people who are contributing many jobs and helping people achieve their version of the American dream. So when it comes to immigration at a whole, we have to look at being able to accomplish both things, being able to have more increased legal immigration and also border security. I think what we hear is both sides saying we can only have one or have the other, when the reality is we can have both. We need both sides to work together. And that's also another common misconception. Democrats don't get to define alone what immigration reform looks like. And at the same time, Republicans alone don't get to define what immigration reform looks like. We need both sides to come together. And it's unfortunate that in my lifetime, there's been zero done on immigration reform. So when the partisanship comes along, we've seen it hasn't worked. We need both sides to come together. Now, when I look at DACA, who are dreamers who came here at no fault of their own, these are people who 96% of them are currently either in the workforce or in school. So that's nearly, what the entire program expects them to be doing. People who are contributing $10 billion to our economy. I know a few dreamers, and I had the opportunity and privilege to take a few of them to Washington, D.C. to meet with members of Congress so they could share their stories. And there's two of them in mind right now who are members of my church. And one of them, Hector, I've got permission to talk about them. He's the drummer of the church. He's also the leader of our men's group. Also is an entrepreneur, has his own business. He learned a trade, went to a tech school, learned how to fix electric appliances. And he actually is the person who installed my new AC unit in my house a few years ago. And then the other is my good friend, Jessica, who as well has a family here, who studied here and started her own business. She's got her own nail salon. So these are individuals who are providing for their families, who aren't depending on any government assistance. And we're sharing that story to our members of Congress so that we could see that we want a permanent solution for dreamers and DACA recipients, specifically because they, again, are a big asset to society, and we don't want them in limbo. And that's where we're at now. One day, they're not sure if they're going to be here to the next. There's some promises that they're hoping to get through. At the end of the day, it looks like there could be some opportunity here coming up soon that LIBRE would look at and hopefully supporting, because we are hopeful and optimistic when it comes to this.
Absolutely. And then just like you mentioned, there are certainly a lot of misconceptions of immigrants, right? But if we look at hundreds and hundreds of years, I mean, the US was founded on immigrants, whether they came from Mexico or Europe or any other country. I mean, we certainly are a melting pot of different cultures. And we certainly need to find some kind of solution for all these folks that are in limbo, like you mentioned. And there have been a lot of studies and statistics that show that many immigrants that have come to the US are folks that are helping us kind of get through COVID, right? They're health care professionals. I know that there was a story recently about a young lady who paid her way through school, and she's working for NASA now, and she helped with the shuttle that landed on Mars not too long ago. So there's certainly a lot of great stories that we've heard about folks that are coming over here, but you're right, there certainly needs to be some kind of solution for them. And transitioning a little bit from immigration reform and touching on healthcare, obviously we've seen a lot of different innovations with healthcare. Of course, with COVID, I think we're already in our first year anniversary that everybody's been kind of living with this new normalcy. But telemedicine has been a huge topic. Are you a proponent of providing accessible healthcare to the greater population through options such as telemedicine?
Absolutely, yes, I am, and the LIBRE initiative is. The reason why is because we want to provide greater access to care at an affordable rate. I live in a rural area, and telemedicine makes it there's an opportunity for people that can reach their doctor if they're not able to go in person. Whether if it's for concerns for contracting COVID or to protect someone with underlying conditions in their home, or maybe they just have to work and can't get away from the office or don't have a car. So that having that option would only be better for Hispanics and for all Texans alike. One thing that we have found in common as I meet with members of our state house and Senate and listening to members of the community is that we kind of want the same thing. We want better access. We want affordable care. And so the appetite is there. And we're seeing that actually there's a rural health info, which is you can go to ruralhealthinfo.org. It's a website that shows you the access to care right now. And I found that in places like in El Paso, the primary care physician, there's only 4.8 primary care physicians, so less than 5 for every 10,000 folks. That's not a lot. People in Hidalgo County, that's 4.5, so a little less primary care physicians for every 10,000 folks. And in Starr County, which is right next over to us, there's only 2 primary care physicians available for every 10,000. That's not good. So telemedicine would help expand that. And just spinning off of the telemedicine and healthcare reform that we've been, working on, LIBRE and a lot of other folks in Texas, because it certainly is something that's important.
Advanced practice registered nurses, right? That's another vital part of our health system. And excuse the lengthy question, but I think that it's important to add a little bit of context to let people know exactly who they are and what they do. But essentially, they're registered nurses educated at master's or postmaster's level. They're prepared by education. They have a certification to assess, diagnose, and manage patient problems, order tests, and prescribe medications. Texas law does not allow physician assistants or nurse practitioners to practice independently. Unfortunately, there are a lot of regulations for that. However, Governor Greg Abbott temporarily waived this requirement. What is your view on permanently removing this barrier for APRNs in Texas?
Well, look, the governor relaxed these regulations last year because of COVID. My question is, if he relaxed these regulations to help Texans to have greater access to care during a time of need, why have them in the first place? So yeah, LIBRE is supporting a bill to help advanced practice registered nurses, physician assistants, people that have the experience to be able to practice to the fullest extent of their education. So what's that mean? Basically, there are times when a physician assistant or APRN, they want to prescribe medication, they need to get approval from a physician, a doctor. Right now, they don't need to do that because we don't want to backlog when there are a lot of people that need to be seen. That's one area. The other area that was loosened the regulations was that prior to loosening the regulations, Governor Abbott or the primary care physicians, the physicians themselves, could only see or supervise up to 7 people. So that's 7 physician assistants or APRNs. Right now, there is no limit, and you don't need to report that to the Texas Medical Board. It just needs to be a verbal agreement with who your supervisor is. So that is kind of getting some barriers out of the way so that physician assistants or APRNs can practice, again, to the fullest extent of their education. We believe that would help us have more opportunity to meet with, if you don't have a doctor in your neighborhood, all you have is an APRN, you should be able to meet with them without any questions or concerns and be able to get the care that you need and the medication that you need without having any roadblocks in the way.
And through your kind of research with all this healthcare reform and telemedicine and the licensing, have you found that Texas is losing, potential healthcare workers to other states because of these types of barriers and regulations?
Well, I have read, and specific in your area, Carla, of medical professionals actually working in New Mexico, getting their license there and being able to practice there, and they may get paid more money just because their regulations are different. And now, obviously, we want the best care for all Texans, and so we'd love to have them here. So one of these things, there is a bill that we are watching in the House right now that would allow advanced practice registered nurses to be able to practice how they learned how to practice. I mean, they are educated professionals who we should trust in when it comes to seeing them. So we definitely would want them here. But yes, I know in El Paso, there are some that have been going to Las Cruces, for example.
And we had a couple of sessions ago had some professors from the local community college that are exactly confirming that as well. There are less regulations in New Mexico. That's about a 30-minute drive from El Paso, and we are losing some healthcare workers, unfortunately. Continuing on the healthcare reform piece, Medicaid has obviously been a huge topic and a concern for many Texas legislators are being urged to expand Medicaid coverage to healthy, able-bodied individuals. How does expanding Medicaid save money for Texas?
It doesn't. So that's a false notion. Every state in the union that has accepted Medicaid, they have all destroyed their budgets. And that's not something we want for Texas. And also, there's 2 sides to the Medicaid thing here. There's the budgetary side, and then there's the healthcare side. On the budgetary side, like I said, usually it's underreported or undercounted how much money we actually need to spend for Medicaid. And that's what we've seen in all the other states that have Medicaid. So they're spending a lot more. And the problem is it's not a one-time expense. It's an ongoing expense. What does that mean? It's forever. And the fact that Hispanics are on average 10 years younger than the rest of America, that means we are the lucky ones that get to pay for that kind of money or that bill at the end of the year for a lot longer. And that's not fair to us. And then you talk about the healthcare side. Well, Medicaid was meant for the elderly and disabled. If we expand that to everyone, that's going to be a problem because it's going to bog down our system and more people are going to have to go see the doctor. That means there's only one option, and that's Medicaid. And that's not going to help save any money. That's actually going to increase our costs. So we want more options because not everyone fits in the same bucket. It's not a one size fits all. You have different needs, medical needs than I do. So why should we all be seeing that same doctor and paying a lot of money for it when it's not going to be beneficial to us?
Absolutely. And we've also heard that there are examples of states that have expanded Medicaid. How are they faring with this expansion?
I know that in Kansas, for example, they've tried that, and there's a lot of myths out there, basically busting those myths, saying it's not going to help increase opportunity to healthcare. We believe, again, that the best access to care is having more options. So that's what we are seeing. And I don't think it's the best thing for Texas. And I know for Hispanics, it would hurt us financially. And again, we came to this country to work hard, to get ahead in life and achieve our dreams, whatever your version of that dream is. And expanding Medicaid is only going to make it worse. And it's going to make it more difficult for us to get there.
And you may have mentioned this a little bit, but I know that LIBRE has been working diligently with legislators to improve access to individualized care options. What is that exactly, and how can we encourage our legislators to be proponents of something like this?
Well, at the national or federal level, if you go to our website, thelibreInitiative.com or BeLibre.org, and you look up the personal option plan, just search personal option, you're going to see what we believe would be a great individualized plan. And there are 4 areas that we're looking at. One is we want to expand access to care. I've been mentioning that throughout this entire time, because expanding access means that you have more option and more choice, which means you're going to be paying less out of your pocket. The second is reducing the cost. So because you have expanded access, you're actually going to reduce the cost. The third is ending surprise medical billing. Now, thankfully for us in Texas, and efforts in the last legislative session, thanks to Senator Kelly Hancock, Texas no longer has surprise medical or no surprise billing because of a law. So we need to know now up front what we're going to pay for whatever procedure we're going to have. That's a good thing. So we want to take that model here in Texas and make that a national thing, so it happens all across the country, where people know up front what they're going to pay for the procedures they're looking at paying. And lastly, we want to make sure that we ensure safety nets. What I mean by that is making sure people like my mom, who are on Medicaid now, have the ability to pay for procedures that they need to pay, because Medicaid doesn't pay for everything. So there are things like house savings accounts for seniors that we're looking at, legislation filed in Congress. Something like that would be very helpful. So those are the areas, and we believe the personal option is better for individuals because you have individual needs that are different from my individual needs.
That's true. And I mean, we've talked a lot about over the last couple of months now, right? Like Texas legislative session kicked off, and we mentioned this on one of our presentations, but typically there's anywhere from like 8,500 to 9,000 bills that are introduced during just Texas legislative session, right? And only about 10% of those are actually passed. So how can we, not only here in El Paso, but Mission, McAllen, all over Texas, what are some things that our audience can do to participate in this process I mean, are there petitions we can sign, or how can we get more involved with some of this stuff that you're talking about?
This is my favorite part. So thanks for asking. It's how do we take action? How do we get involved? There are many ways, and even through this time of COVID, you can take action from your desk in your office or on your couch. You can go to our website, as I mentioned earlier, belibre.org or the libreinitiative.com, and there's a Take Action Center. You click on the Take Action button, and there are different volunteer scripts, basically, that you could sign one if you're for it, like making telemedicine permanent. If you agree that you want to make telemedicine permanent, you put in your information, and it sends a letter to your state representative, to your state senator, and in support of this bill. That is a quick way to take action now. The other is to get connected, whether it's sending us a message on Facebook or Twitter, letting us know what you think. That way we know where you're at, and we can connect you to the local field engagement director that we have, so that they can connect you correctly. But that's the biggest way right now that would help us, because we want to make these policies pass, because it removes barriers. And what that means is that we kind of get things that are in the way, push them out, and we can get closer to having more opportunity, in this case, for better healthcare access.
Absolutely. And we've mentioned this before on many of our presentations. We are a nonprofit, nonpartisan organization, and we want to work with anyone from all sides of the aisle, right? If you go to our website and you may not agree on one of our policies for immigration, for example, or healthcare, there are still other ways that you can get involved. Maybe you agree with our stance on criminal justice reform, for example. So just like George mentioned, we do encourage all of you to take some kind of action. We will continue to have these events with different folks in our community around Texas, as well as legislators around the state, to make sure that we're continuing to provide this information for our communities, because it is really important for us to be more educated about these important things that are happening around our state and around our country. And George and I have been colleagues for a long time now, and it's always a pleasure to have him on and to kind of educate us on all these important policies. And so I appreciate your time, and hopefully we can have you back on, because we do have a couple of more months left of session. I'm sure a lot of things are going to change in those 60 days. So hopefully we can provide more updates to our audience. And again, thank you, George, for joining us. We really appreciate your time.
Thank you for having me, Carla. It was great to be with you.
Of course. Is there anything else that you'd like to add before we end our session today?
We're good to go.
All right, and like George mentioned, please visit our website, also Facebook at LIBRE Texas, and we will have another presentation next week with Representative Art Fierro, so please join us, and we hope that you'll have a great evening. Thank you so much.